Hello, my name is Natasha Sinayewie, and today I'll be talking to Dr. CK of Refined Skin and Beauty Clinic, and we'll be talking about weight loss in various ways to lose weight, and he will be explaining everything to you. Please, guys, join us on this YouTube, subscribe to our channel, and please stay until the end because we have a small surprise for you. Hello, Dr. CK.
Good afternoon. Good
Good
afternoon.
afternoon. Good
How are
afternoon.
you
How are
today?
you? I'm
Thank you. I'm good. I'm
fantastic.
good. Thank you for having me here.
Yeah, so how are you feeling today? I can see you looking amazing.
Feeling good after the rain we had yesterday, heavy rain and everything, but we're good today.
Oh, even this side it rained. So basically it was an East African problem.
We had flooding at our clinic, so it was quite bad.
Wow, sorry. So today we need to talk about some weight loss programs. Yeah, there's what is Allurian program?
Well, first, before we get into that, I want to say weight loss affects all of us, a lot of people. I have
Yeah.
combated weight issues for a long time. I was 114 kilos in about February this year. I'm
Wow.
82 kilos now. So some of the things we're going to talk about, I've actually done on myself.
Wow, amazing. That is
Good. I feel
amazing. That
good.
is
I'm off all my medications, so things are good.
yes.
So
Wow,
weight loss, the
that's
Plurion program.
yeah.
Now, a lot of people come to me for weight loss procedures where they don't want anything invasive. They don't want to be cut open, have bariatric surgery, or so to speak, and
Yeah.
they don't have the patience sometimes to follow through with a dietitian or exercise. So the
Yeah.
Allurion program is really a very nice patented product coming out of the USA. Got worldwide recognition, lots of cases done, very safe. It's a sort of ingestible capsule, about that big, piece of chicken. You swallow it, you're awake during the procedure, and then we inflate it into your stomach, about 500 ml of fluid. And it's like a restriction to your food intake, mechanical obstruction, so to speak, in terms of
Okay.
what you can intake. So it helps you lose weight.
Okay. So do you have to be a certain kind of weight and how does it make you lose that weight exactly? So that's something
So
we need to
first of
understand.
all, the criteria is age. So anybody over the age of 16 or 17, I won't do it for anybody younger than that. Usually, you need a body mass index, which is your measurement of your weight and your height over
Yeah.
30 or over 27 with medical problems. How it works is like when you intake food, think of a small pouch. When you eat food, the bottom of the pouch fills up and it gradually fills up the whole pouch. And then it sends a chemical to the brain once
Yes.
the top part of your stomach is extended, telling you that you're full now, you're satisfied, so you stop eating. This
Okay.
is by having this capsule in the stomach, it stays there for about 4 months. It's inflated with a special type of liquid, and it restricts, it's always there. So it extends your top part of your stomach, sending you chemical to the brain that you're
Mm.
full. When you eat, you can't eat as much because you already have something occupying the space in the stomach. So that's
Okay,
the
but
physics.
best okay. But based on what you're saying, that means you need don't you need a nutritionist to be able to be on
We
this
do.
program?
So the success of it does depend on engaging with the nutritionist, who will initially see you once a week, then once a month to help you through the sort of food intake to have. And what we
Yeah.
find is after somebody's actually taken this step to have the balloon put in and they've paid all that money, they are more likely to engage with the nutritionist because then the success is better. They do
Okay.
10,000 steps a day, they eat the correct type of foods, not indulge in ice cream or fried foods, they lose the
Yes.
weight.
Okay, but then now you say that you put the balloon in and you put in the water and all that. Okay, imagine I don't understand. I only understand the balloon that I buy from the shop, right? And the water. How exactly would you explain to a layman how that balloon goes in?
So you we give you a balloon. It's a small tablet, like a small
Yes.
capsule. You swallow it with water. It's connected to a tube because we
Mm-hmm.
need the tube to expand the balloon. So like similarly, a water balloon, you connect a hose pipe to fill up the water in the balloon. The hose pipe is this tube that is connected to the balloon, the tube that you've swallowed, or the balloon you've swallowed.
Mm,
And
mm.
through that, we fill up the balloon in a process that takes less than 5 minutes after you've swallowed that tablet, and it expands in the stomach. We take an X-ray to make sure it's in the right place, and then we pull out the
Okay.
tube, and you
Okay,
go
so
home
so
with the
it,
balloon.
okay, so if you're explaining to a layman, you're going to say balloon. I would think the balloon that is from the shop. What is the material that is made
It's
of
a
this?
special type of silicon balloon. It's a
Okay.
medical grade. It's
Okay.
sterile, not contaminated. But
Okay.
when you explain it, yeah, it makes sense. It's like a balloon that you filled up. And after
Okay.
about 4 months, the balloon automatically deflates and comes out.
Okay. So how long does the balloon stay in the stomach, you said?
Between 3 to 4 months, usually about the
Uh,
4 month mark, by which you should have lost at least 15% of your body weight.
Okay, so if is it based on the index and how you put in the balloon, would there be a time that that balloon will stay in for longer?
Well, if it does stay in for more than 5 months or 6 months, we have to go and deflate it. But it's never happened. To me
Okay.
or to the cases in East Africa that we've had, we've never heard of it happening.
Okay, and then the one of the most concerned question is, does the weight come back?
Well, if you go back to all your eating habits and drinking a lot of alcohol, it can. However, studies have shown that 95% of the weight that you've lost in that time of the balloon is kept off
Okay.
at 1 year. Because your
All
body,
right.
the stomach is a muscle. Over time, over many years, is when it's expanded and accommodated all that food. Now, over
Okay.
the 4 months, that muscle relaxes. It's like not going to the gym for 4 months and you lose all the muscle mass.
Mm-hmm.
Again, to build it up and to get the stomach big again will take quite some time for it to accommodate all
Mm.
that food. Obviously, if you go back and drink a lot of beers, sodas, you'll put on the weight. But after
Okay.
you've done that and you feel good, it's a self fulfilling prophecy, so to speak, that once you've lost the weight, you want to keep maintaining or keep healthy because you feel good in yourself, feel more
Yeah,
energetic,
definitely.
medication.
Yeah, definitely. You should be the model for this because you said you came from 100 and that now you're in 80s. Like you should be the face card for this because that's amazing. So there is also the fact that we use IV as well for nutrition. So what is IV nutrition?
So again, a lot of people, layman people, will say, I take a lot of vitamins or green vegetables. A lot of things are digested by the stomach. You don't absorb all the vitamins in there. So this has become very popular now, where we give you intravenous, meaning through the vein, like we're having a drip done in the hospital. But in that drip, we combine all different kind of things you may need, from
Yeah.
magnesium, whatever it may be. Glutathione is very popular in Uganda or in East Africa for skin lightening or brightening, so to
Yeah.
speak,
Yes,
for
yes, yes.
energy levels. So we have vitamin B complexes that help with weight loss, vitamin C that helps you with, again, fighting off infection. So if
Yeah.
you've been taking vitamins orally, tablets, you're not absorbing everything. So by giving it through the vein, you're getting what is called 100% bioavailability, means your body can use up everything it needs, and we
Yeah.
can make those cocktails different to what you require.
Okay. So how do I know as a person that I need IV nutrition and what particular IV do I need?
Well, first of all, given this day and age, all of us are deficient at some form of nutrient, whether you like
Yeah.
it or not. You take
Yes.
vitamins. I have patients who have had a big night out. Kampala on a Friday, Saturday night, as you know, is rocking.
Yes.
So I
Yes.
get
Yes.
patients calling me on Sunday saying, I want to have IV vitamin therapy done. Calabash, we've started opening at Calabash at Wampeo and at
Yeah.
Munyonyo, where they can come in for IV rehydration to get the paracetamol for the headache, fluids and
Yeah.
sugars to get the energy levels back up while they have a massage there at Calabash. At the
Mm.
clinic, we can have it with glutathione. So if your concern is your skin, you feel your skin is dull, dehydrated, there's a cocktail for your skin to brighten you up, make you feel younger and
Mm.
beautiful like you, Natasha. I think you've had the IV you can talk about.
Yes, exactly. Definitely, I can talk about it because if, as you can see, my skin is glowing from the inside out. And when you take it, it helps with so many other things. It's not only the skin and everything, even internally, you feel quite
Yes.
different. Like it's
So by the
amazing.
time you see the skin, that's something important. You said by the time you see the effect on the skin, it's cleansed you within. It's
Yeah,
detoxified you, given you energy
very true.
levels. So we have vitamins for sports people who will work out a
Yes.
lot. So that's called the performance and recovery. I have
Mm.
something for brainstorm, for mental improvement,
Yeah.
for people who are
Yes.
mentally tired, lethargic. You can have vitamins to stimulate your mental development. And that
Okay.
tells me, so if you're watching this video, please follow us, like it. There's a lot of information that we keep coming out on our videos.
Yes.
We do believe people don't want to read so much, so we talk about it and
Yes.
watching it
Yes.
live make it
Exactly.
better.
Yes, yes. And even the fact that when they ask these questions, they always want to hear the doctor say this because even if I say something, they're like, okay, yes, you look nice, but when the doctor says it, it makes much more sense.
And in layman
Um,
terms, like you said,
yes,
say it in layman's terms.
exactly.
It's
Yes,
difficult for
very
us
true.
doctors sometimes to put that across.
Yes, exactly. We know it always comes very big. So, what is unique about the IV to a certain level? What is so unique about it that when you are given as a person, what, and let's say you do any consultation? Do you do any blood checks to be able
Well,
to understand?
there are some basic like vitamin drips that can be done without seeing the doctor. For
Okay.
example, you call the hangover drip. You want some paracetamol, some hydration, vitamin C. You can
Yeah.
get that done without seeing me. The
Okay.
more advanced you go on the IV journey, yes, it is important to see the doctor. We do blood tests to make sure that
Okay.
your kidney, liver, etc. are fine.
Mm.
But these are for more advanced cocktails. Most
Okay.
young people, when they don't have any medical issues, really can get the IV done without seeing the doctor.
Okay.
We do have a standard health questionnaire they should answer. And if you do
Yeah.
have any kind of health issues, then the nurse will say, see the doctor first before getting the treatment done.
Okay.
As the advanced, what I talk about, we can bespoke vitamin therapy. So if you're somebody who suffers from frequent asthma attacks or migraines, have high blood pressure, etc., it's better to see the doctor, and then we can curate or create the cocktail that is ideal or unique to you for your benefit.
Okay, that's amazing. So basically, even people who are suffering from chronic diseases should come to Refine for these particular IVs.
Correct. They can help you with your outlook, your energy levels.
Okay.
Take away some toxins that the medication might be bringing to you. So it helps cleanse your system as well.
Okay, that's amazing. So what again, layman's terms, because you see, this is one of the biggest concerns everybody always has when they see someone going through the IV therapy. They always, oh, you're gonna have long-term effects and all that. Are there some side effects to this particular nutritional therapy?
I've not had any, but yes, there are some side effects possible.
Yeah. Yeah.
If you're giving high flow vitamin flow to somebody with heart problems, you can overload the heart and put them into heart failure, for example. I've
Okay.
not had any allergic reaction, but allergic reaction is possible for anything in the world. You can be allergic to, I
Yes.
mean, sunscreen,
Yeah.
for example.
Yeah.
So if that does happen, we have things in place to make sure that we can manage you to
Mm.
make sure you don't get any serious detrimental effect. But on the
And
whole,
yeah.
99% these are natural vitamins or trace elements that we call that your body needs, whether you get it from food, from sea fish, uh, whatever it is. These can be supplemented back to you, so your body gets a lot of it.
And this, the long term, there are no side effects to this particular
Not that we
IV.
know of. This has been there for a long time. IV vitamin therapy has been practiced for decades.
Yeah, but I guess it's just common now and people are seeing it and being concerned about it.
It's more the worldwide trend and push towards prevention and wellness, which is
Yeah.
happening everywhere in the world. People, after COVID especially, people don't
Yeah.
wait to fall sick. You're trying to prevent that. So this is helping you
Sure.
be healthier.
Yes. Okay, amazing. So that is part of the the therapy, because I do it. As you can see, my skin is glowing amazingly. This is what happens. Hair looking good and everything, because it has really worked in the period of time I've used it, and I haven't been using it like as frequent as I should, but it's looking good. So still on on the nutrition, what is semaglutide?
So semaglutide actually, Natasha, it's based on nutrition, but it's for weight loss. Now,
Oh,
semaglutide
okay.
is a big phenomenon worldwide. I had a patient last week who was prescribed semaglutide in South Africa.
Yeah.
South Africa doesn't have any doses; they'd run out. So
Wow.
semaglutide is a medication that was initially used for diabetic patients, to treat their blood sugar levels. People with high blood sugar are diabetic; they require tablets or insulin injections. So similarly, this is a medication that is injected to help reduce your blood glucose. How it
Mm-hmm.
does that? It increases your insulin levels. So if you're not a diabetic patient who takes insulin, increases your body's own insulin levels, thereby
Okay.
using your body's fat as an energy source. So it does
Okay.
two things. One, it helps use up the fat in your body as an energy. Number two, it reduces your appetite, so you eat less and thereby lose weight gradually over time. It started off as a small dose, once a week in small injection, and we
Okay.
build up the dose gradually over 4 or 5 months to the weight loss amount to help you lose weight. So I've got patients again. This is what I did. This is a medication I
Yeah.
did. So when we go back to it, I went from 112 to 82 kilos on this treatment. It
Okay.
requires one small injection every week. Small side effects initially, it's a bit of nausea, diarrhea, possibly. Then
Okay.
in long term, when you start the higher doses, a bit of constipation can come in because you're
Mm.
eating less. Your food transit
Yes.
time going from your mouth to your, when you pass out the stool, the
Okay.
transit time is a lot longer. So again,
Okay. Okay, so for someone, let's say you had a healthy appetite, I would say you eat 3, 4, 5 meals a day, and then you go on the semi-glutide, and then it cuts your vitamin. Isn't that something that would affect your body in some kind of way?
So we do give you vitamin supplementation. We talked about the IV
Okay,
vitamin therapy. However, there is a weekly vitamin injection that covers the main vitamins that you need,
okay.
given to the muscle. There's a small dose that covers that. Now, again, it's important that when you're on this program, you don't start. It's not going to be zero intake. You're going to control the food intake. So now
Yes.
you'll have to stop the chapati, for example. I don't know how much nutrients you get from chapati rather than being
Yes,
full.
yes,
Your
yes.
matoke and posha intake will come down. Your green
Okay.
vegetables intake will be fine. You'll be able to eat green vegetables, which will be good for you. Get a lot of
Mm,
iron from there, so it help you also not reduce the constipation. So green vegetables are good that way. You'll
okay.
be drinking a lot of water, um, protein, chicken, fish, very good. You'll just be
Yes.
avoiding or reducing the bad stuff. I mean, the high dense carbohydrates, pastas, things like that will be come down.
Yes. Okay, so basically, like again, back to the same thing, being that you were eating a certain kind of way, then definitely your energy levels will go down. What exact IV therapy can you recommend to someone going through semaglutide so that they can be able to have the energy to go through the day and be able to do some work, I would say.
See, I said like when we're doing the semaglutide weekly, we're also giving you something called lipominomics, which
Okay.
has
That,
which has vitamin B12, vitamin B complexes, vitamin C. But on the IV, if you're the full-on IV, there's the performance and recovery IV that has
okay.
manganese, sulfate, a lot of different elements in there, in addition to high dose of vitamin C and whatever you may have. But when
Okay.
you say the energy decline, for me, I'll give you my example. My
Okay.
energy did decline a bit, but now that I'm off my blood pressure medication, I've got more energy to see my friends, more energy with my wife in the bedroom, whatever it may be. So things are better for
Yes.
me overall.
Yes. Yeah. That's amazing. So this is something that anyone, it's recommended for both male and female.
Yes, provided you're
Okay.
the age of 16, below the age of 65.
Okay.
If you have medical conditions, obviously we need to see you. Very rare issues of thyroid problems, so we do a thyroid blood test. I take you through all the history. Again, people say, what about the side effects? For me, I was taking 3 blood pressure tablets. I had high cholesterol. All those medications I was taking was obviously going to, I mean, I was facing an early death anyway with all
Yeah.
that
Yeah.
medication and all the
Yeah.
issues of my weight. Now that
Yes.
I'm
Yes.
off that, I've got more energy. Number one, so the side effects that I had from the semaglutide,
Yeah.
the constipation, etc., you may have were
Yeah.
minimal compared to the side effects I may have from long-term use of high blood pressure tablets, or forget about the blood pressure tablets, the high blood pressure itself, or the cholesterol,
Yeah.
the amount of
Yes.
food
Yes.
I was taking.
Okay. So there's also a little bit of a concern right now. We live in a society where we have obese kids. We really have kids from the ages of 10 to 20 who are really obese. And what would you do for kids in that bracket? Because
See,
you
so
say that
obesity
this
is a
particular,
pandemic. Obesity is
yeah,
a pandemic worldwide. Unfortunately, I can't do it in this terms of the treatments. Before the age of 16, we're not allowed to intervene. We can
okay,
intervene with nutritionists, lifestyle
okay,
advice, counseling. Obviously, the parents have to be counseled because they're the ones who manage the food intake for the children.
yes, yes,
In
yes.
terms of treatment and medication, sorry, we can't do anything before you're 16.
You can do it. Okay, but can you do anything for someone who is above 65? Because also you said you stop at 65.
So over 65, the semaglutide has not been
Yeah.
approved for anybody over the age of 65. But earlier we
Okay.
talked about the Allurion program.
Yeah.
There's no age limit to that. There's a
Okay.
patient in Kenya who's about 77 years old who's done it twice.
Okay.
She's fantastic. She loses weight. She's good.
Wow, that's amazing. That's amazing because most of the time that's the one thing we'll say what is there for my bracket. But if they can't do that particular program, then I think it's good for them. So as you've had, guys, there is a lot at Refine Skin and Body Clinic that you can do to lose weight. Because I know most people want to lose weight. And if you see Doctor right now, Doctor is looking fire. So you guys need to join on these particular programs and get your weight down. Because I know that's something that takes away your self-esteem. And you just can't, because even I gained some weight when I came out of COVID. So I was like, oh my God. So I understand when someone is feeling so insecure with their weight. So please, guys, join us. at Refine and get that weight away from us 2023. So thank you so much, Doctor. I appreciate what you've given us today. I can't wait for us to have more chats like this because people really need to know what Doctor has to say. So thank you very much.
Just
See
one thing
you.
before you finish, yeah.
Yes.
So if you can just get the listeners to send in the questions, we have our website, our WhatsApp, our contact numbers are everywhere.
Yes, please,
Follow us
guys,
on Refine Skin
subscribe.
and
Yeah.
Body,
Yeah.
refineskinandbody.com, because this is the time when I can answer your questions. We can talk about it, and follow the YouTube channel because this will be important
Yes,
for you.
please. Yes, guys, subscribe because every time we have a live, we always have something at the end. So please, guys, subscribe. Follow all our pages, Refine Skin and Body Clinic on Instagram. Go on our website. Everything is there. The doctor is ready to answer all your questions. So thank you very much for joining us on this particular day. Bye, doctor. Have a great
Thank
day.
you. Bye bye.
See you. Bye bye.